When looking at a patient in identifying their needs orthodontically, many times we can identify that the patient has a poor functioning tongue. What does that mean? A poor functioning tongue can have a lot of impact on whether or not we're going to be able to treat this patient efficiently and whether we're going to have stability afterwards. So what is a properly functioning tongue? A tongue that is resting against the roof of the mouth during breathing and swallowing. And during the swallowing pattern, the tongue should be placed behind the upper front teeth. Oftentimes we may see patients who come into the office who have what is described as a tongue thrust. A tongue thrust is when the patient protrudes their tongue between their anterior teeth or brings it forward against their front teeth during the swallow. Other patients may have what's called a lateral tongue thrust. In that type of patient, when they swallow, their tongue is placed between their posterior teeth and stabilizes the teeth during the swallowing pattern. Aberrant or abnormal tongue patterns during swallowing need to be corrected if you're going to be efficient and have stable outcomes in orthodontics. Oftentimes, we can do things in the office to treat these conditions, but our feeling is if there is a structural relationship between the upper and lower jaw, it is more important to correct the structural relationship first, then train the swallow and the resting posture of the tongue afterwards. It's hard to ask a tongue to fit into space that's too small for it, although that space being too small might in fact have been caused by the tongue. So in our hands, we oftentimes will do some preliminary orthodontics and then use appliances to try to retrain a swallow. If our efforts are not sufficient enough to take care of it, a patient can be referred outside the office to either a myofunctional therapist or a speech pathologist to treat an abnormal swallowing pattern.